Audio Jungle.
Like Mr. Alok said, like spine is something like one of the greatest evolution in the mankind. Like with Dr. Panikar said, one of the reason like for this degeneration is age. நம்ம சொல்ற மாதிரி ஒரு ஆக்சிடென்ட் ஆச்சு, இல்லைன்னா pregnancy-ல anesthesia கொடுத்துட்டு back pain வந்துச்சு, lots of that is myths around it. But degeneration is one of the main reason. அதில் spine specialty பார்த்தீங்கன்னா இப்போ கண்ணு போச்சுன்னா cataract வந்துச்சுன்னா பார்க்கும்போது தான் பிரச்சனை. Similarly, if you see if there is a knee pain while you're walking, it's the problem. Gastric வந்துச்சுன்னா சாப்பிடும்போது தான் எரிச்சல் இருக்கு. But when your spine gets disturbed, it's like a core. உங்க மொத்த flexibility it gets affected. That's the what and the importance of spine, which I felt. Because I'm a living example here. Like I finished my graduation from Madras Medical College, Rajiv Gandhi Hospital தான் படித்தேன். ஸோ என்னோட ப்ரொஃபஸர் தான் வந்து டாக்டர் கருணாகரன் சார். நான் படிச்சுட்டு 2003-2009 பேட்ச். ஸோ எனக்கு ப்ராப்ளம் வந்துட்டு அப்புறம் the first person I felt is to reach out to you. The problem has been there for quite a long time, but recently like past during this lockdown it is quite aggravated. ஒரு ஸ்டேஜ்க்கு மேலே என்னால் லிட்ரலி எல்லா பார்ட் ஆஃப் லைக் நார்மல் ஒர்க்காக இருக்கட்டும், எழுந்துக்கிறதா இருக்கட்டும், கோயிங் ஃபார் ரெஸ்ட் ரூம், பாத்திங், எவ்ரி பார்ட் ஆஃப் லைஃப் இஸ் காம்ப்ரமைஸ்ட். சர்ஜரி சொன்னீங்கன்னா என்ன சொல்லுவாங்க எல்லாருமே, இல்லை பண்ணார் அதுக்கப்புறம் எழுந்துக்கவே இல்லை. ஒரு as a relationship, நிறைய பேர் was stopping me from it because they have seen only those kind of cases, they have heard only those kind of cases. Nobody who successfully has come from the surgery never speaks about the other people. அது ஒரு ரீசன் இருக்கு. இன்னொன்று வந்து இட்ஸ் us who is suffering from the pain. நம்ம தான் கஷ்டப்படுறமே தவிர அவங்க சொல்லிட்டு போயிடுவாங்க இது பண்ணாதீங்க அது பண்ணாதீங்கன்ட்டு. பட் யூ வில் பி over the period of time you are actually deteriorating your body. அது இன்னும் அதிகமாகி பெர்மனன்ட் நர்வ் டேமேஜ் வரைக்கும் நம்ம கொடுத்துட்டு போகிறதோட when it's the right time to get especially when the surgery is so simple. நான் வந்து மார்னிங் 5 o'clock was I got admitted. Next day around 6 o'clock I was discharged after this surgery. And the level of relief is like it's like miracle எனக்கு. அது முன்னாடி இருந்ததுக்கு நான் கஷ்டப்பட்டதுக்கும் next day before the relief that I got is so good. I have so many people when I tell them this is what I underwent, they were saying that oh இப்படிலாம் surgery இருக்கா அப்படின்னு கேட்குறாங்க. But still it is not yet reached to the people. I would urge you, it's completely like I was in theatre for around 40 minutes anesthesia. For 1 hour I was completely back. So it was completely like a seamless. கொஞ்சம் எல்லாருக்கும் surgery பயம் ஃபர்ஸ்ட் டைம் இருக்கும். மற்றபடி the procedure as such is simple like a normal, you go for a wound dressing or whatever it is. So I would surely recommend you please when you've been suffering a lot, maybe a family member or relatives, யாரை பார்த்தாலும் கண்டிப்பாக சொல்லுங்கள். I feel the cost is quite negligible compared to the pain I felt, and the insurance is completely borne the expenses also. I'm glad that the insurance company is actually giving it the entire package out of insurance. So please do inform everyone about this, especially the infrastructure which the global has. That's the reason I chose this global hospital. I have contacts across all the hospitals in Chennai. I am a medical officer of Mahindra & Mahindra Limited. We are a network across all the hospitals. But the confidence I have in this hospital and the confidence I have in Dr. Karnakaran sir has actually made me to decide to choose, and I went for it, and I'm glad that I have done it. Thank you all. Nandri.
Everyone, welcome to some of the patients who've had procedures done here. Thank you so much for spending your time and coming here. Welcome to members of the media, and a very warm welcome to our own doctors, Dr. Panikaran, Dr. Karnakaran, Dr. Selvasita who has joined us. So if you look at the history of spine, right, what made humans different from primates? We evolved from monkeys, right? Eventually that is the case. It was 3 things. Development of an opposable thumb, which allowed us to use tools. So if the thumb is not opposable, you can't use tools, right? Like a hammer and chisel and knife. The other thing was a larger frontal cortex, a large area of the brain which allows you to think. You think more, you think about the future. And the third and equally important thing was the spine. So this erect spine is something which is very essential to our daily life, and we don't even realize, right, how important the spinal cord and the intact spine and the right spinal muscles are. When I passed out medicine in 2002, in the year 2003, I was asked to assist a spine surgery where they were trying to remove a disc, a slip disc. It was very, very scary for me, a young doctor who had absolutely no idea what to do. So my senior told, you know what, this thing is the spinal cord. Okay. and we are going to strip the muscles, because to remove the disc in earlier days, this is about almost 20 years ago, they had to strip the muscles and one person had to stabilize the spinal cord, because you get a lot of bleeding in the area of the surgery. To stabilize the spinal cord required a person who would make sure his hands don't tremble or shake, because if the cord gets damaged, the person will not be able to walk ever again. That's how dangerous it was, that is how risky it was. And the field had a lot of blood because it's highly vascular. And look at now, where you can make a very small incision and take out the disc without placing the spinal cord to any risk whatsoever. Right? And somebody who has had pain in the back or slip disc pain, only they realize how difficult it is. As we age, what is happening is we have now people with a longer life expectancy. People live 70, 80, 90 years, right? And it becomes more and more important to make sure our posture, our spine, our muscles are actually intact. Having said that, still people get slip discs, they get back problems, and it is amazing how medical technology has grown to a level where with an endoscope and with a very small incision, you can actually take out the disc and relieve pain for the patient immediately without putting them at any risk whatsoever. And with neuroimaging techniques, you can actually visualize the spinal cord so that you don't damage it during the surgery. On this note, I am very proud to actually announce the launch of Advanced Endoscopic Spine Center, and I congratulate the doctors, Dr. Karnakaran, Dr. Fanikiran, the entire nursing team, technicians, and all of GGHC on this momentous occasion. Thank you very much.
Introduction. And thank you, Dr. Alok, for sharing your spine experiences. It was a very nice experience to actually from there, my journey had started. Views basically on spine surgery. The fundamental view where it made me change is from our Nobel laureate, Dr. C.V. Raman. He always said that science has to go close towards nature. So that made me keep thinking, so how we could contribute and go close towards nature in doing a spine surgery. So in that way, how did we reach close to spine? By preserving the nature. And other thing the view which always kept bothering me was when somebody says, or even when I say somebody to undergo a spine surgery, there was a big no. Spine surgery? No. Don't get operated for any sort of a spine procedure. So there was a blank statement. These two views which constantly keep disturbing me and made me think brought me to a concept called tissue preserving spine surgeries. So this is the concept with which we have now today launched the Advanced Endoscopic Spine Center, where we deliver what we want without causing any sort of damage. This for a disc problem, if it's not getting resolved with non-surgical modality, the surgery becomes a very useful tool. But surgery by definition, it has to cut through layers. You have to cut through to reach a particular part. By cutting, you are going to not only cause collateral damage, like you have to reach a particular spot. To have to reach a particular spot which is in depth, you have to cut structures and go to it in a really in a blood-filled zone. So you have to avoid it by preserving the tissues. How it can be avoided? By using a beautifully designed tool called the endoscope, which many procedures have been done with an endoscope. People would know that if you can put an endoscope into the stomach, you can put an endoscope into the lungs. So this is basically a tube which has to connect from the exterior to the interior. So I can view whatever I want by putting a tube, preserving the entire muscle. So this is basically a sutureless endoscopic spine procedure where whatever I have to do is accomplished, preserving all the natural structures. What we mean by the natural structures is the anatomy is still preserved, no structure is damaged, but the damaged part, the disc which has come out, which is irritating and causing the nerve, the damage and the pain is being addressed by an endoscope. So this is a very simple procedure but giving great results. So we put this procedure as a simply great procedure. So what I request people is that the myth that spine surgery should never be done should be removed, and when it is necessary after a good trial of conservative treatment can be addressed very effectively if it is done in the right time, the right place, with the right people. So I would, at this juncture, when people are asking for votes, and vote should be towards vote for endoscopic safe spines procedure, and I request all the media people to spread this message, because this not only damages the patient, it also influences the society. The most important part is we need a healthy spine. So vote for endoscopic spine surgery, vote for a healthy society. Thank you very much.
First of all, I would like to thank all the patients who have come here for listening to our invite and accepting and coming here. Thank you very much. எல்லாருக்கும் நன்றி. Why எதுக்கு உங்களை எல்லாம் கூப்பிட்டோம்னா, பேஷண்ட்ஸ் நீங்களே you have gone through it. For surgery சொல்லும்போது, ஸ்பைன் சர்ஜரி சொல்லும்போது, first thing is fear. ஏதோ பெருசாக போகுது, ப்ராப்ளம்ஸ் வரலாம், அந்த ஃபியர்ஸ் எல்லாம் எல்லாருக்குமே இருக்கும். இட்ஸ் நேச்சுரல். எனக்கு சர்ஜரி சொன்னால் ஐ ஆல்சோ பி அஃப்ரைட். பட் த ரீசன் எல்லாம் கூப்பிடுறது எதுக்குன்னா, when the others see that அவங்க நினைக்கிற மாதிரி இல்லை, there is rapid advancement and change in the last few decades the way spine surgery is done. So the results, maybe there was some poor understanding and some poor results 20 years back, 30 years back, but with all these advancements, all that has changed a lot. So that is the message that we want to spread in the people. So in our spine, disc problem is the most common problem in spine. Disc prolapse, lumbar disc prolapse. First thing when somebody has edunala actually, why it happened to me. So on the why answer is not one reason. People think because I am overweight I had it, because I had a fall 10 years back adunala actually. It is not like that. It is because there is a natural aging of the disc. The disc undergoes age-related changes. வயசாக டிஸ்கில் தேய்மானம் வரும், எல்லாருக்குமே வரும். அது டிஸ்க் பல்ஜ், டிஸ்க் ப்ரொலாப்ஸ், எம்ஆர்ஐல இருக்கிறது வந்து எல்லாருக்குமே இருக்கும். ஆஃப்டர் சர்டன் ஏஜ் எவ்ரிபடி ஹேஸ் சம். பட் அதனால சிம்டம்ஸ் சில பேருக்கு தான் வரும், நிறைய பேருக்கு சிம்டம்ஸ் இருக்காது, பெயின் இருக்காது. அந்த சிம்டம்ஸ் வர்றவங்களில் சில பேருக்கு தான் அது நரம்புல ரொம்ப சிவியராக ப்ரெஸ் பண்ணி காலில் நரம்பு போகிற இடத்துல அவங்களுக்கு ஷியாட்டிக்கா ஒரு நர்வ் ஃபங்க்ஷன் அஃபெக்ட் ஆகி கால் நம்னஸ், டிங்லிங் அதெல்லாம் வருது. அது மாதிரி சில பேருக்கு தான் ஆகும். அந்த சில பேரில் 90% தன்னால் சரியாகும் வித்தவுட் சர்ஜரி. இப்போ நாங்கள் ஸ்பைன் சர்ஜன் சொல்கிறோம், பட் எல்லாருக்கும் சர்ஜரி பண்ணுறது இல்லை. 90% சர்ஜரி எல்லாமே சரியாகும். அந்த மீதி 10% அது ட்ரீட்மெண்ட் எல்லாம் பண்ணி சரியாகல, இல்லை ரொம்ப சிவியராக சிம்டம்ஸ் அதிகமாக இருக்குது, நரம்பு ஃபங்க்ஷன் எல்லாம் அஃபெக்ட் ஆகிருக்கு, காலில் பேரலிசிஸ் மாதிரி ஆகுது. அந்த மாதிரி இருக்கிறவங்களுக்கு சர்ஜரி தான் பெஸ்ட் ஆப்ஷன். ஸோ அந்த டைமில் அந்த மாதிரி இருக்கிறவங்க சர்ஜரிக்கு பயந்துட்டு ட்ரீட்மெண்ட் பண்ணாமல் இருந்தால் எதுக்கு பயப்படுறாங்க? ரிஸ்க் இருக்குன்னு பயப்படுறாங்க. தெர் இஸ் அ ரிஸ்க் இன் சர்ஜரி. பட் இந்த மாதிரி சுச்சுவேஷனில் சர்ஜரி பண்ணாதனால ரிஸ்க் அதிகம். இஃப் யூ டோன்ட் ஆப்ரேட் தெம், they will get more risk of problems, risk affecting their lifestyle, their mobility, losing the function in the limbs. So many times because of fear, people may take a wrong decision. So the reason we have called you all is to send this message that spine surgery is very, very safe. You have all gone through it and you are back to your work and lives, and that is possible for anybody who needs it. ஸோ அந்த மாதிரி பேஷண்ட்ஸ்க்கு உங்களை பார்த்து அவங்களுக்கு ஒரு கான்ஃபிடென்ஸ் வரும். ஓகே, இது தேவை இருக்குது, இது பண்ணால் இந்த மாதிரி திருப்பி சரியாயிட்டு ஐ கேன் கெட் பேக் டு மை லைஃப். அந்த மெசேஜ் கொடுக்கறதுக்கு தான். ஸோ அதுக்காக நீங்கள் எல்லாம் வந்தீங்க. தேங்க்யூ. அண்ட் கேன் வி ஹேவ் couple of those slides, just two slides to show how the spine surgery has evolved.